You know how you call the doctor sometime, need to make an appointment, and you're lucky if you get in 3 to 4 weeks. Then once you get to the doctor's office, you're lucky if you get in to see the doctor in 3, 4 hours. So what can you do about that? Well, there's a great concept. It's called MDVIP. And here at 15 Marks in Ocean Springs, just west side of the Ocean Springs Hospital, is Dr. Striegel. And we're going to talk to him today and let you know what that MDVIP is all about. Dr. Striegel, how are you, sir?
Doing fine, thank you.
Tell us a little bit about yourself, if you would, please. How long have you been in this area?
I'm a practicing internist. I've been on the Gulf Coast since the early 80s and have been practicing at this new location with my new practice for about 3 years now.
Now, as I mentioned in the opening, you usually go to, if you go to your general practitioner or something, you call and say you got a cold or for whatever reason. Usually it's going to take you 2 to 3 weeks to get an appointment to get in there. And then once you get there, you're going to be sitting there for a while. What is this MDVIP concept? I mean, it's a whole different ball game when it comes to seeing a doctor.
Yes, it is. It's more patient oriented. It's where you pay an annual fee, and I've capped my patients to like 500. And by having fewer patients, I can spend more time with the patient. So when they call and they're sick, I can either see them that same day or the next day. And every patient gets a 30-minute time slot.
That's unheard of. I'm sorry, that's unheard of with a doctor to see him either the same day or the next day. I mean, that's wild. Plus, what is it? You give them your cell phone number?
I do. It's actually, you give them your cell phone number. It's there if they ever need you for an emergency.
Right.
Either after hours or on the weekends. And it's not abused at all. I have other patients or physicians who think that I get inundated with phone calls. I don't, because they respect my time off and they call only when needed. So it's worked out very well for me.
That's good. I mean, that's good. You have that type of rapport and relationship with your patients that they can feel like they can do that, and knowing that you're going to respond and not get a phone call from answering service or whatever.
All right. It's part of that personal care.
Now, as far as personal care, we're going to talk about in just a few moments about some of the different things that you do deal with. But whenever you pay that rate, the charge, that is along with your insurance.
Yes, it is. It works with your insurance. That annual fee basically pays for me to have fewer patients. By having fewer patients, I can spend more time, and it gives you a more complete evaluation of your health and future health plan.
The patient doesn't feel like they're just a number.
That they're off the assembly line, basically.
Because I mean, how often do you go in a medical office and it's like, take a number, and you're just serving number 50, on a daily basis. Could be the way it feels sometimes. Well, you do deal with a lot of different things. We're going to go back into one of the examining rooms and talk more about what exactly is MDVIP. Okay, let's talk about the procedure here. I come in, I've signed up. And I come in for my initial checkup. What do you do?
Basically, like I had mentioned earlier, before you see me, 2 weeks before that, you've seen the nurses, and they've done all these pre-diagnostic tests and exam and including blood work and the other things I mentioned. Then you come into the room here, and I spend an hour with you in here. I do a head-to-toe exam.
An hour?
An hour. Yes.
Again, unheard of. I'm sorry. Go ahead.
So I do an exam here, head-to-toe exam, and then sit over here and basically go through all the results that we've obtained and then come up with a treatment plan.
And the whole idea is to get someone on the road to being well again.
Absolutely.
What other, as far as any kind of issues, what issues do you deal with as far as, coronary, diabetic, or any of that stuff?
The main problems you deal with are what's common here on the Mississippi Gulf Coast, and that's diabetes or prediabetes, cholesterol, blood pressure, weight, and lack of exercise, and I deal with all of those.
You check everything. Whenever a person comes in here for that, as you said, when they meet with the nurse, they get blood work done, which you send off to a lab.
Right.
And then you check what's the weight mass or
percent body fat.
Percent body fat.
Right.
Check it, and
Yes.
Do a really thorough checkup. Even you do the carotid. You have the ultrasound that does
Yes,
the carotid arteries.
We do. As we know, half the patients who have heart disease have normal cholesterol, and over half the patients who have heart disease also are pre-diabetic. So why is this? Well, we look at cholesterol differently. We look at the particle size and find reasons for that. Well, and when we the numbers are one thing, but when you look at the carotid arteries, you're actually seeing what's actually going on in the patient. They may have great numbers, but if they have a significant amount of plaque in the arteries, then what you're doing is not good enough. And we make changes so that this plaque cannot progress and hopefully prevent heart disease and strokes in the future.
And sometimes it can be as simple as just changing your diet.
Diet, what do we call therapeutic lifestyle change, which is diet, exercise, weight loss, and of course.
And no, a lot of people hate that D word, diet. You know, you're on a diet. I don't want to be on. And it really, if you think about it, as a lifestyle change, and it's a lifestyle change for the better.
Yes, it is.
Because you want to stick around, on Earth, possibly as long as you can.
What I've really learned with this program is that time is the essence of good medical care. The amount of time that the patient and the doctor spend together, that is just so important with a person's medical care. Time for me to listen to the patient, time for me to examine the patient, time for me to evaluate and think about what we found, and time to treat. And at times, I've also times to think about stress, to discuss stress with the patient. Everyone has stress in their lives, and if need be,
we know it.
And if need be, to console them, or if necessary, to pray with them as well. So it gives really gives me time to spend with the patient.
So you go beyond that. You also the spiritual end of it as well.
Yes, there's no doubt with the more time you spend with the patient, the more trust that develops between both the patient and the physician.
And being able to be so close one-on-one with a patient like that, or with any of your patients, you grow a great relationship on an individual basis with them.
You do. They become more of a patient, and many times they become your friend as well. So it's you end up becoming almost a family when you deal with your patients.
And you're the only one down here doing this.
On the coast I am. Yes, I am. Which actually stands for Value in Prevention.
Value in Prevention.
Yes.
But then again, you make that person feel like a VIP because of the way that you treat them. If you'd like some more information, the phone number is on the screen. They're located at 15
Marks Road.
Marks Road, which is just on the west side of the Ocean Springs Hospital. If you turn at the light there, instead of turning to go into Rouse's, you take a left, and it's right there on the left. Look for the blue sign. Can't miss it. Call and make an appointment, and get an evaluation. That's what you do.
Yes.
Dr. Striegel, thank you very much for this great insight. Great program. It's called MD VIP. Dr. William Striegel, his office is located here on Marks in Ocean Springs.